What are warts? Warts are non-cancerous skin growths caused by a viral infection in the top layer of the skin or mucous membranes. Viruses that cause warts belong to a family called human papillomavirus (HPV). The appearance of a wart depends on where it is growing. Warts are usually skin-colored and feel rough to the touch, but can be dark, flat or smooth. There are several different types of warts. The first one I am going to tell you about is called common warts. Common warts grows around the nails, on the fingers and on the backs of the hands. They are more common where skin has been broken, for example where fingernails are bitten or hangnails picked. The second type of warts are foot warts. Foot warts are usually on the sole of the feet and they are called plantar warts. When plantar warts grow in clusters they are known as mosaic warts. Most plantar warts do not stick up because the pressure of walking flattens them and pushes them back into the skin. These warts often have black dots that are actually blood vessels. The third type of warts are called flat warts. Flat warts are smaller and smoother than other types of warts. They tend to grow in great numbers. They can grow from 20 to 100 at any one time. They can occur anywhere, but in children they are most common on the face. In adults they are often found in the beard area in men and on the legs in women. Irritation from shaving probably accounts for this. Many people can get warts and not even know they are there. It just depends on what kind of warts you come in contact with. Some warts can be painful and even cause burning just depending on where they are located on your body. Warts probably are passed from person to person, sometimes indirectly. The time between the first contact and the time that the warts can be seen is often several months. The risk of catching hand, foot and flat warts is small. Wearing shower thongs, taking proper care of hands and feet can limit the spread of warts. Genital warts seem to be more contagious. It is important to use precautions to limit the spread of genital warts. Some people will get parts and some will not get them. It just depends on how they come in contact with them. If you do come in contact with warts, here's how you can get rid of them. Warts often disappear without treatment over a period of several months to years. However, since warts can be spread to others or new areas of the body, it is reasonable to treat most people, especially if the warts are bothersome or painful. Some people will get them burned off with AICD or being froze off it. These methods both can be painful, but it works. There are some wart remedies available without a prescription. However, you might mistake another kind of skin growth for a wart, and end up treating something serious as though it were a wart. If you have any questions about either the diagnosis or the correct way to treat a wart, you should seek medical advice. Warts appear as raised, rough-textured, grayish growths that will vary in different sizes from a pinhead to large masses. Warts are viral infections that will usually appear on the skin, but they can also appear on the genitals or in the rectum, urethra, your bladder, or even on your mouth. When you see a wart start showing on your skin, the virus usually will enter through a cut, crack, or a scratch and incubates a few months before erupting into a wart. Most of these warts will go away on their own without any treatment. However, warts that will appear on the genitals, around your fingernails, or on the palms or soles of your feet are particularly long-lasting and can be difficult to treat. In your children's case, warts will usually last a few months to a year. In adults, they commonly will last months to even years. Many people may never completely get rid of the warts and can be bothered by many recurrences throughout your life. The most common skin warts are the most prevalent type. They may start to grow large and then generally erupt on your hands and fingers, though they may also show up anywhere on your skin. Warts that appear on the soles of your feet, that are called plantar warts, grow inward rather than outward. The common warts are mildly contagious and are often spread on the same person by picking, scratching, shaving, or biting your own nails. They also can be passed on to others through direct contact. Genital warts are often passed between sexual partners. Before you call your doctor, Duofilm, which is an over-the-counter plaster, can be fairly effective of getting rid of your warts. Make sure that you follow the directions on the package exactly how it tells you. The immune system also will fight wart viruses, so anything that you can do to stay healthy will help tremendously. In addition, the medicinal herb echinacea is an immune stimulant. Studies have shown that when you take this orally, it will help fight the viral infections by stimulating the release of interferon, your body's own virus-fighting chemical. Echinacea teas, pills, and tinctures, which are most commonly known as alcohol preparations, are available at health or food stores in your area. When you do decide to call your doctor, physicians will treat your warts most likely by freezing, cryotherapy, burning, cauterization, chemicals, and scalpel or laser surgery. Freezing surgery will leave a scar, but the freezing method to get rid of your warts actually causes the least amount of scarring. What you should do when a wart appears. Most warts disappear naturally, often within a few months, but can sometimes be years before they disappear. You may prefer to wait for this to happen, but if you do have warts that are really bothering you either by the way they look or feel, you should seek treatment. There are 2 known cases where you should see your doctor rather than treating these warts with over-the-counter medicine or self-help treatments. The first type of wart is called penile or vulval warts. The other is if you have any other wart of any kind show up on your skin if you are 45 years old or older. In older individuals, what looks like a wart could actually be a more serious skin condition, such as skin cancer. There are 4 kinds of malignant melanomas. The typical appearance is a malignant melanoma. Usually this takes the form of a dark, slightly raised lump. Such a malignant growth that can look like a wart also can occur in an existing mole, and cause it to enlarge and perhaps bleed. Another type is a large brown fleck on the face, which occurs in the elderly and takes 15 to 20 years to become malignant. A blue, brown, or black lump that bleeds easily, and a dark area that enlarges near the tip of a finger. So as you can see, warts can be treated if they are indeed warts. If, however, you do nothing about the wart and it is not a wart, very disastrous things could become the outcome. So always look at what can be done for warts or any other skin condition you or a loved one may have. The elderly usually do not want to bother their family members for something they think is common, such as a wart, because they believe it is just from their aging and are probably just spots that they get as they get older. If you are a family member of an elderly person, check their skin to see if they may have a wart of some kind or possibly a skin condition that needs to be treated immediately. When you have knowledge about skin conditions that can occur on a person, you can help a person that may need answers about their possible wart or any other skin condition they may have. I have had to go to the doctor with my husband for his skin cancer, and what he has to go through because he waited too long is very unpleasant. He let one piece of skin cancer go too long that was on his temple, that he had to get it cut out. They had to cut very deep 5 different times to get the skin cancer out, so knowing what to do when you have any skin condition can be life-saving. Whether it may look like a wart or not, get it treated immediately for your own protection or a loved one's. Wart treatments that work. Warts are harmless, non-cancerous skin tumors that can occur singly or in groups on any part of the body. The type of wart is named as per the region of their occurrence. Warts are caused by different strains of the fiendish papillomavirus. It conjures the body into providing it with room to flourish. This is known medically as the wart proper. Warts are non-malignant skin tumors that can appear on any part of the body. It is named depending on the region of its occurrence. 75% of the population encounters warts at least once in their lifetime. Plantar warts are the ones associated in the foot region. Most of the natural remedies for warts are associated with plantar warts. As a reminder, it must be ensured that the so-called wart is not a corn, callus, mole, or cancerous lesion. If there is the slightest doubt about what it is, a doctor must be consulted. To help identify, warts are pale, skin-colored growths with a not-so-smooth surface. Sometimes it has even borders and blackened surface blood vessels. Normal skin lines will not cross the wart's surface. Warts are, however, very shallow growths and do not extend up to the bone. Most warts disappear on their own within 2 years. Children get rid of them faster. However, warts are infectious and if left untreated, may increase in size or spread to other parts of the body. Normal medical wart treatments are associated with nasty-sounding destructive methods such as burning, freezing or destroying with laser. These techniques are not necessarily effective. It is usually painful and may leave scars. Worse still, warts often reappear, no matter what treatment is used. Alternative medicines for warts, especially home remedies, are therefore encouraged before heading for the doctor. Special precautions should be taken when attending to genital warts. One common home remedy is to buy vitamin A capsules and apply the oil directly to the affected area. Fish oil or fish liver oil capsules are the best source for vitamin A. Fish or fish liver oils capsules should be broken open and the oil massaged into the affected area once a day. The vitamin should not be taken orally, large doses of it can be toxic. A paste of vitamin C tablets and water is one suggestible home remedy. The affected area should be bandaged after applying the paste so that it does not come off. The acidic property of the vitamin, particularly when in ascorbic acid form, affects the skin too. Therefore it is important to ensure that the paste does not touch the skin. Another popular home remedy is the onion method. In this method, a small onion piece is cut and kept dipped in vinegar overnight. In the morning, this onion piece should be placed over the wart and taped up tight. Another similar piece must be kept dipped in vinegar, ready for the next change. The onion should be changed at least once a day. Warts are bothersome, so do not let them irritate you any longer. Warts can be aggravating. Indeed, the warts, moles, skin tags etc. can be unsightly. They might not be painful so much physically, but they do generate emotional pain. The ugliness that is most often associated with warts and also at times with moles is detestable, particularly from the cosmetic point of view. No wonder why so many people desperately seek worthy treatment measures for removal of the skin lesions. Any treatment course for moles and warts need ideally start with checking the right causative factor. The warts viruses cause the skin lesions. These are responsible for producing the bumps on various parts of the body, including the soles at times. The warts formed display a granular nature. Medications aimed at controlling the infection ought to be administered in consultation with specialists, physicians. Being a viral disease, the warts are contagious too. So, it is also important to check the infection before it spreads to other persons who are susceptible. Deficiency of potassium in the system can also be the cause of wart formation. In such case, potassium-rich foods like meat, fish, milk and vegetables should be taken in a plenty in diet. Mineral potassium-rich nutritional supplements pills may also be taken in on a regular basis. The surgical measures are usually considered if the medicines, creams, lotions etc. applied for treating warts fail. This is also considered if the skin lesion formed is showing signs of becoming cancerous. For example, a mole may have changed shape and color. The surgical procedures enable removal of warts more precisely. They also help take on larger lesions. Surgical procedures commonly followed in cases of lesions are generally pretty quick and simple. Not even an overnight stay is required. You need to be careful too. It can be that a margin of the skin around the lesion may need to be removed while removing the warts, thus creating the risk of leaving a bigger wound that is more conspicuous than the original wound. A treatment measure commonly followed is freezing of the lesion with liquid gas. The wart area may also be treated with salicylic acid and other chemicals that are painted on the area. This is later washed off and the affected area is dried and perhaps covered with some protective strip. You may be suggested to check your smoking and dietary habits for fostering better wound healing and reducing chances of infection. It is local anesthesia that is applied for wart treatment, and soon after the operation this loses effect and pain can be felt. So, painkillers are prescribed. You need to be careful too. It can be that a margin of the skin around the lesion may need to be removed while removing the warts, thus creating the risk of leaving a bigger wound that is more conspicuous than the original wound. Warts are pretty ugly little fellows, but there is no need in you feeling ashamed. You can do something to get rid of them if you really want. How can you get rid of warts? Warts are very common. In fact, virtually everyone will experience them at some point in their life. They are very contagious and are spread by person-to-person contact. And although they are painless, unless they are on the soles of your feet, their dark appearance can be felt to be unsightly. But the good news is that warts are harmless enough and normally disappear by themselves within a couple of years. Although treatment is not needed for most warts, and the wart itself will clear up in time, some people do feel the need to remove these unsightly growths. Plus, one of the other reasons people get them treated is because treatment helps to prevent warts from spreading to other parts of your body and also to other people. There are various types of treatment, and they generally involve the physical or chemical destruction of the lesion. Medical professionals have differing treatments they can offer, and these include keratolysis, which is removal of dead surface skin cells usually using salicylic acid, blistering agents, immune system modifiers or formaldehyde. Over-the-counter medications can remove warts. These are applied to the wart every day for several weeks. Do not use these medications on your face or genitals. It helps to file the wart down when damp, for example, after a bath or shower, before applying these medications. There are many options you can use to remove warts. Over the counter and going to your doctor. It is up to you on how you want to go about getting them removed. Interestingly, placing duct tape over a wart may help it disappear. A small study had people wear duct tape for 6 straight days, remove it, wet and scrape the wart down using a file, and then reapply the tape the next morning. This was done until the wart disappeared, for no longer than 2 months. The people wearing the duct tape had as much luck getting rid of the warts as those who had warts frozen off by a doctor. This method might be worth a try if you have a painless, yet unsightly wart. If there is pain there, you may not want to try the duct tape. You may want to wait until you have gone to see a doctor about it. Because if there is pain there, it could be infected or something else. You need to contact a doctor to be on the safe side. So, whilst warts are very common and most people will experience them at some point in their lifetime, and they are caused by a viral infection, they are generally harmless and will disappear in a couple of years. And even though warts are actually benign tumors of the epidermis caused by a virus, it is nothing to worry about. And bear in mind that warts are highly contagious, and if you do get one, it has probably been transmitted from person to person contact.